Rubber Stamp Parliament opened its summer session using video conferencing to carry out the proceedings for the first time. Joining us live from Vietnam is Ralph Wandolph Empire. Hello, Ralph.
Hi there, Alma. Pleasant evening to you. How are you doing?
I'm doing good. Thank you for asking. How are
That's
you?
great. I'm okay. I'm good. It's pretty hot here in Hanoi. It's summer now. So, yeah, Alma, now for the latest updates here in Hanoi. Yesterday, Vietnam's Lawmaking National Assembly commenced its first ever online session against the backdrop of the ongoing pandemic. The ninth session of the 14th Tenure National Assembly is scheduled to take place from May 20 to June 18. The session will be divided into two phases, with the first organized as a teleconference from May 20 to May 29. Chairwoman Nguyen T. Kim Ngan and Hanoi-based delegates will attend the session at the NA Building or National Assembly Building in the capital. Other National Assembly members in other provinces and cities in the country will tune in from their respective local offices. The second phase, which runs from June 8 to June 18, will be held traditionally as all deputies across the country are required to show up at the NA building in Hanoi. Following the opening speech of Chairwoman Ngan, the legislators listened to the government's reports on the country's socioeconomic development. Delegates are set to spend most of the first day considering the ratification of the EU-Vietnam Free Trade Agreement and EU-Vietnam Investment Protection Agreement. They will spend more than half of the working time on lawmaking, including voting on 10 draft laws and discussing 6 others. During the ninth session, the National Assembly will also consider and make decisions on some socioeconomic and state budget issues. Now, in other news, Alma, yesterday during the video meeting of the UN Security Council, Vietnam has called for special attention to responding to the COVID-19 epidemic, which is exacerbating the humanitarian crisis in Syria. Deputy Permanent Representative of Vietnam to the UN ambassador said humanitarian access must be maintained in all areas in Syria and a favorable security environment must be ensured for humanitarian activities. He appealed to the international community to support Syria in this difficult time, including ensuring the supply of food and medical supplies necessary for COVID-19 prevention and control. And for the latest update about COVID-19 cases here in Vietnam, a total of 324, 263 have recovered, and the 61 active cases are the Vietnamese who returned from abroad and they're now under treatment. The British pilot, the critical COVID-19 patient, is now free of the coronavirus, but remains on life support. In the past 19 days, he has tested negative for the virus 5 times. However, the hospital director said a lung transplant is still on agenda as decided by the health ministry last week. For now, the patient is still suffering from pleural infection and is not ready for a transplant. Free of the virus, he has been transferred to the Cho Ray Hospital for further treatment. Experts from the ministry will work together to decide whether he needs more organ transplants besides his lungs because some of them have been damaged, Cho said, without elaborating. The nation has spent about 5 billion Vietnamese dong, equivalent to 215,000 US dollars, over the past 2 months on the British man, and the estimated cost of a lung transplant is about 1.5 to 2 billion Vietnamese dong, or equivalent to 65 to 86 US dollars. The Viet Duc Hospital in Hanoi has been asked to get ready to operate once the patient is eligible for a lung transplant and matching donor is found. So far, 60 people in Vietnam have volunteered to donate part of their lungs to the British man, but doctors said they would give priority to donations from brain-dead donors. The situation is complicated by the fact that the pilot had said he has no relatives when he was still conscious. Under current regulations in Vietnam, all surgical interventions must be agreed by the patient or the patient's authorized representative. Now, a few more updates, Alma. The Deputy Minister of Health stated that Vietnam has conducted 275,000 COVID-19 tests as of May 12, or 2,000 daily tests. Religious activities in Vietnam were allowed to resume from May 8, but with preventive measures for large gatherings. Furthermore, the government has allowed the resumption of all non-essential services except for clubs and karaoke parlors, but with preventive measures. Next, the Ministry of Transport on May 6 relaxed social distancing guidelines on planes, buses, taxis, and ships. And lastly, public beaches in several cities and provinces, including Da Nang, Nha Trang, Binh Dinh, Thanh Hoa, Quang Nam, Quang Ninh, Thanh Hoa, and Nghệ An reopened, but with social distancing restrictions. In addition, tourism activities resumed in Halong Bay and Bai Tu Long Bay from May 1. Back to you, Alma.
All right. Thank you for your updates. Ralph, do take care of yourself.